I'm Rob Parks, and I'm the co-founder and CEO of Service Robotics. Service Robotics is at the forefront of ushering in a new era of hybrid care, a new model of hybrid care using technology, and in our case, GenieConnect. And I have to start by saying that the news, which I'm sure you all know, is that the care system is broken. Age UK estimate there are 1.5 million people in the UK with an unmet care need of some type, and not just older adults. And people are hurting, real people are hurting, and the knock-on effect on the NHS is also devastating in that people who are medically fit to be discharged cannot be discharged because they don't have the right care package at home. And that is knocking on to the effect of ambulances queuing at A&E, unable to admit their patients. So we are very proud to be working with a truly progressive leader in this field, Nyree Laugharne from Cornwall Housing. But first, I'm going to hand you over to my colleague and our business development manager, Imogen Keane. Many of you may have spoken to Imogen already about how we can help you improve the lives of those you care for. So over to you, Imogen.
Brilliant, thanks Rob. No introduction needed because you've done that, so that's brilliant. So as Rob said, so today what we're going to be doing is in sort of about 45 minutes, you'll hear from our partner Nyree around how she and her team have implemented a hybrid care solution using GenieConnect, which we'll introduce you to, and reflect on sort of what their needs were, why they were looking for sort of technology, and the outcomes of implementing a technology. So going through a bit of the agenda of 45 minutes. It'll probably be around about 30 minutes with some questions at the end. So we're going to go through some sort of best practices from Nyree and within sort of 3 key areas, and highlighting as well around how we build excitement and engagement within a team, and how we move to a more digital care provision alongside in-person care as well, and how that works. So we are tackling the care crisis, as Rob mentioned, by providing a hybrid solution with the help of GenieConnect through remote care. Today, as I said, we're going to be focusing on 3 services in which remote care can help build independence, tackle loneliness, and release capacity within the care system. Hybrid home care, so here we're looking at how to provide a solution to be used in someone's home, and can provide useful prompts and reminders, automating some of those care tasks, as well as increasing connectivity to family and friends. And you'll hear a very touching story about a gentleman, which I won't reveal any more of. I'll leave that for Nyree. Nyree will be focusing on the Genie Hub, increasing, again, the touch points for residents to provide an increased level of service, highlighting what the importance is of digital equality, connection and community, as well as how to engage and excite that team as well. Finally, but by no means, we're going to be looking at enablement and tackling that hospital to home care crisis, ambulance wait times, and the bed capacity issues that we've all been hearing about. So how do we do this? Service Robotics. So we're going to introduce you to Genie. So Genie is a voice-activated remote care companion, linking with the wider circle of care through the companion app, as you can see on the screen here, as well as the care portal, to provide a whole cocoon of care of all the stakeholders that are involved with that individual's care, with the benefits of improving medication management, mood awareness, healthcare reminders, personal hygiene, independence, and remote support and connectivity as well, with all the features that are highlighted on here. And to bring it all to life, before I hand over to Nyree, I'm just going to share with you a bit more of the features of Genie, so that as Nyree's talking, you can hopefully visualise, what the elements of the service are, the functions. So this is Genie. So we've got Genie's screen up on the screen here, hopefully. So Genie, as I said, is a voice-activated and touch-activated service that's been built with the user in mind in terms of the simplicity and the way in which we access functionalities within Genie. So if I just take you through the home screen, we've got sort of the key 4 features that are of core to Genie in the system. The first one is around the organizer. So within the organizer and the calendars, we can schedule through the remote care system, through the companion app, through the care portal and on Genie, reminders and prompts that will help enable that automation of tasks to enhance someone's independence, but also provide the capacity for more meaningful care tasks to be done in person by the care and support team. So you can see here there's a variety of different categories. So our medication, hydration reminders, preventing things like UTIs and therefore hospital administrations from that, as well as then mood reminders, which come up on screen to check that the person is feeling okay today, which is passively monitored then by the care portal. So an interaction by a care team can be issued if needed, if it's out of trend. The other main attribute is around the calling function, and we've got various categories of people, as I said, around that individual's care, as well as Genie Buddies, which links in Genie to Genie calling to try and enhance the communities and try and beat loneliness within our communities by pairing up similar individuals. And what I can quickly show you is a quick video call and how we answer that. So I'm just going to make a call from the companion app.
Do you wish to answer?
Yes. Okay, so a split screen that comes up. With the voice activation, what that enables me to do is answer that by just saying yes or no, which then opens up this accessibility of individuals that either have visual impairments, mobility issues, or are just outside of that room that Genie is in. Video functionality, really important. Won't go into it too much because we're short on time, and I'm sure Nyree will go into it as well. The other sort of key things are around the entertainment. So we've got a suite of different activities to try and increase the engagement that someone has with our platform. And lastly, but by no means least, is an information directory where individuals can access services that are bespoke to their area, which again I know that Nyree will go into. So without further ado, I will hand over to Nyree, who will explain a bit more about what she's been up to.
Thanks, Imogen. So I'm Nyree Laugharne and I manage the independent living service for Cornwall Housing. Historically, we were a warden service based in our older persons accommodation across Cornwall. Like many services, especially in housing and health and social care, we have come under attack. We have had lots of funding cuts, lots of reduced services now. And so one of my objectives was to find different ways of delivering the best services to our residents for less. And that's how I started my journey and my team's journey with Service Robotics. We have in Cornwall a large elderly population, quite often living in really remote areas. So I want to talk to you about one of the first tenants that we worked with and deployed a Genie into his home. So Mr. T, he lived in a very remote seaside village in Cornwall. He had no friends or family close by. He had a long-term illness, poor mobility. So very, very rarely left his house. He used our support services. So one of my team was able to go and visit him once a month. And that was all that funding could provide for this gentleman at the time. And he was very isolated in his home. So he was a prime candidate really for when we first looking at implementing Genie for hybrid care. So he used our visiting service for help with his bills, for general housing advice and support, and initiating care provision as his illness progressed. So we deployed a Genie into his home. And what that meant was he could increase his support time, but at a lesser cost because there was no travel involved. Using the companion app, he was able then to have face-to-face check-ins with his support worker from my team, not just save everything up to that monthly visit. We also then were able to get his care providers and things also implemented with the companion app. So that was one way that we helped him. We also connected him to his sister, elderly sister that lived in Sydney, Australia. They hadn't seen each other face to face for over 20 years. So the first time that they saw each other on the screen, it was a really emotional moment for everybody that was involved. I will always remember him reaching out and touching the screen and saying, "Oh, there you are, it's you." And his sister was exactly the same. And it was such an important connection to make to that gentleman and his family. They wouldn't have been able to connect in any other way due to her being quite isolated in Australia. Service Robotics were absolutely fantastic with the time difference and the extra support that she needed to get set up with the companion app. So in itself, it was just an absolute amazing thing to see. So we connected him to her. So then he went from having contact once a month with one person to regular weekly video calls with my team, long free chats with his sister on the other side of the world. And the change that we saw in his mental well-being was really clear to see. He used the little prompts on Genie as well to manage his mood, so he could let us know how he was feeling. So we were able to then evidence just how much his mood was changing and how his well-being was improving. It was amazing to see. Sadly, he recently passed away. But he told my officer before he passed away that he would always be grateful for what we did for him, and for giving him the tools to be able to reconnect with his sister and build up that relationship at a time where he really needed it. His quality of life improved in those last months, and that was all down to Genie. That's just one case that will always stick with me and made me really realise how much of an important tool Genie can be for people living in our communities. So after we trialled Genie in individual people's homes, we saw the successes. Mr. T was just one of many. We also had a lady living in one of our homes that had cancer, wasn't able to go out. We connected her with family. Genie has been a real lifesaver for her when she's been having treatment and feeling really down. Genie has been able to help her connect with her family that would not have been able to see her due to chemotherapy and worry of infection. She even dressed Genie up for Christmas in tinsel, and Genie's become part of her home. So as our services progressed, we took the learning from that initial hybrid care function and wanted to see how further we could take that. So we have 11 sheltered schemes that my team manage across Cornwall, and we wanted to look at a way of getting these people also connected. Again, due to funding cuts, the former warding service is no longer available. So our residents are trying to adjust to less on-site support from my team. Their needs haven't changed. My staff have been quite overwhelmed, and trying to manage all of their needs on a reduced service, it has been really, really hard. So after various discussions with Service Robotics, and an idea that was sort of generated from just one meeting, we were able to work together to design and deploy what we call our Genie Hub model. It's tailored specifically to meet the needs of our residents while taking the pressure off my staff and allowing us again to offer a lot more for a lot less. We wanted to create a comfortable and private setting where residents could connect to friends, to family, professionals using the robot. We even created personal profiles. So each of our residents has a little QR code. They scan that across Genie's face and it pulls up their own secure personal profile where they can access all of the information and the resources that they need. We listened to a lot of feedback from our residents, and we understood that they were frustrated and that communication barriers were a huge problem for them. So with Genie, they are now able to connect to Cornwall Housing. They can report their repairs, they can make general inquiries to the housing team, all via a face-to-face video connection. What was happening previous to the Genie hubs is they would knock on my staff's door on the office, they would see them, and my officers would have this huge list that they needed to help follow up on all sorts of different things. What the hub has done is that's enabled people to look at those things independently, which has been incredible, really. And also the residents have said when they've used Genie to speak to somebody else in housing, to speak to repairs, they feel communicated to, they feel listened to, and they actually feel that their repair or their inquiry is really being taken seriously, because rather than being stuck in a queue in a call centre, speaking to a faceless person, you know, and perhaps feeling fobbed off, they actually see a face-to-face person, they see a friendly face, they go straight through to our customer services department, and they can actually see them processing that inquiry while they're talking to them. They're not waiting long times in queues, they're not being frustrated, and they can actually see things happen. So already it's increased their confidence in the services that we're trying to deliver. It's also, as I've said, lessened the burden on my staff following up on their inquiries. And more importantly, it's allowed the residents to be more independent and to be in control. They're not having to rely on waiting for somebody to be there. We can support with the bigger things. We have more time now to deal with more serious concerns such as safeguarding and those types of things, whereas we wouldn't necessarily have had that before. So all round, it's creating a really, really good space. We've got a calendar function on Genie, so the residents are able to go in, they're able to access information for things like when works are due to be carried out within their building. That's a huge thing for our residents, because people coming in and out of the building, all sorts of things, and communication, there's less paper flying around now. We're able to go in and do that automatically, so they can go in and check that every single day. They also know when activities are taking place that they might have missed. And by the use of their own personal profiles, their friends and their family and professionals are also able to go in onto their private calendar, set up appointments, set up dates to remind them of certain things that they're then able to access via that calendar. It's a really, really good tool, and helping people to handle what's because a lot of them have lots and lots of appointments and all sorts of things happening in their life, and it can be quite difficult. We have a directory function as well. That surprisingly is one of the main features that our residents have absolutely loved. We created a directory function, and this enables the users to go on, find out information for themselves. The residents have found this really easy to use, and also they've provided feedback to us. We've got a little book there now, and if there's something not on that directory, we can add it to them so that they've got all of that information. We use hyperlinks as well, so that they can actually fill out forms for things that they might need on Genie. We've had one lady completed her blue badge application by Genie, another one organised for her clinical waste to be collected. Neither of these ladies have internet in their own flats, and it's not something that they would be able to afford to do. So by having the Genie connection in that hub, it also offers inclusivity for all, which is absolutely brilliant and something that our residents have never had before. The space also encourages residents to get together. Since the pandemic, we still have a lot of our residents that are quite reluctant to mix. It's been a lot of work trying to get people back out and feel safe in socialising again. So the hubs are a really great space. slightly different to the communal lounges that we provide. They're a sort of a smaller, more, you know, comfortable space. We've got refreshments in there for them. And we've got one of the groups in one of the schemes has set up a knit and natter group. So there's a few of them that go in, and they've set up BBC Sounds by Genie. So they've got all sorts playing in the background while they go in there and have their little get-togethers. And when I spoke to them about this, they all used to knit, because they knit things for the hospitals, for the baby units and things, but they all did this separately in their own flats, and they just got talking and said, oh, why don't we do this? So they've themselves, you know, one thing I've learned over the years is trying to get people to maintain that independence and get my team to promote that independence. The hub is doing that, and it's helping us to achieve all of those targets. It's amazing. One of our tenants said they felt calm, and it was lovely to have a dedicated area when no one was watching them. Simple access and reduce the resistance to online services. They went in a little bit apprehensive, came out really confident as to how easy it was to use. But also my team themselves have played a huge part in making this a success. They have engaged with the residents in every way. One of my officers brought his young children in as well last week to use Genie and to get some of the older people up that were a little bit reluctant. So they will do anything they can to show that positivity and enable residents to come in and use it. One tenant said, I didn't intend to use it. No, thought it wasn't for me, waste of time. But you've shown me how easy it is, and I can't wait to call my daughter. I will be telling everyone. And to change somebody's perception is half the battle, really. And I can't tell you the positive response and seeing people. I posted actually a video from last week onto my LinkedIn the other day, just to really show firsthand from our residents their reaction on these hubs and how happy they feel to have this provision for them. So I couldn't recommend the hubs enough, and I think they have a lot of scope to go even further. So yeah, it's been a brilliant project for us, and we're learning and evidencing from that project as we go, so that we can take it to wherever it needs to go. So it's brilliant, really, really good.
Brilliant. And now, before we move on to enablement, if you could just share a bit more around how you've built the excitement in the team and that ownership that people have now had with the GenieConnect project and the hubs.
So we looked at, when we were looking at the buildings, we were looking at the private spaces. I've kept my team involved and given them ownership for creating these spaces. They've all sort of been involved in looking at ways that we can make these comfortable spaces, getting them to feedback their ideas. We've had posters, badges, all sorts of things, and the team have been out talking to residents, dropping information into residents, and yeah, building that excitement, really. They're positive, feeding my positivity onto my team, in turn then shows such a positive response from the residents. So working, I would say one of the things has been working really hard to get the team on board and to see how it can alleviate the stress from them. And that was a huge selling point. And they have seen that, you know, they're all coming back and sort of saying, well, I didn't have a queue of people waiting at my door. Somebody had done this, somebody had done that. They've all gone out and looked at different ways of getting people involved. Like I say, somebody brought their children in. They're just using really innovative ways of getting people involved, but that positivity has to filter down, and that's what's happened to get these hubs to work. So
brilliant, thanks, Nyree.
No problem. So obviously we've had an awful lot of successes. It hasn't come without its trials, trying to get internet sorted in some of our schemes and things like that, but we have seen so much success come from our 2 Genie projects that we have been working on. So now for us, It's about taking it to another level. It's about, okay, what can we do next? We're a self-funding service. We don't get any funding from anywhere else. So we rely on that income that we generate to support our service development. We provide assistive technology to people across our communities. Traditionally, we've used Lifeline to do that, as well as our visiting support. But what we're looking at now is Genie and what Genie can do. So coming from a basic Lifeline package to a hybrid home care that we are then again is able to offer more for people, and also regardless of where they are in their care journey. One way we're looking at doing this is by using Genie for short-term reablement. Housing has a huge part to play in the social care crisis. By delivering hybrid care, Cornwall Housing and the Independent Living Service can help to get hospital to home flowing again. We can enable people to remain living in their own homes for longer, reduce premature residential care placements, and ease the workload of other care and support agencies. Housing, through our team, can offer digital support. By using automated task setup and personalised digital care, we can free up capacity for in-person care and also bring in additional revenue streams to further support the services that we provide within our housing stock, which is enabling, again, my service to grow. In return, we can then support care providers to make efficiency savings while also maximising out their resources. So this is the next stream for us. This is where we're going to go and get these reablement projects in place. And it's something that I'm really, really excited about.
Thank you, Nyree. That was brilliant. I mean, you summarised that really well in terms of the reablement side. So we've heard it a lot from multiple different providers, councils, and associations around how the flow at the moment is currently blocked with discharging patients, and therefore obviously leading to the ambulance wait times. And so it's about thinking, how can we use remote care in a hybrid approach to help try and free up some of that capacity to not over prescribe, but be prescribing the right amount of care in the right way and in the choice of the individual to deliver still quality care, but maintaining the fact that we continue that continuous flow of inpatients to outpatients. And using Genie as a way to do that can be partnered with in-person care or just Genie by itself, depending on that individual's needs. And what we've heard is around individuals that are going into reablement beds or short-term care homes and actually not really coming out of that care home because their dependencies increase during that time. And so by using Genie at the forefront of that individual's care to get them out of hospital and with a care package that is suitable for them, it is something that we're looking at to try and prevent that longer term care, but also hopefully an overall reduction in that care package as well, in which after that re-enablement package or time, they can then continue with Genie into their next sort of care package or longer term care package. So it's all around prevention, reduction or maintaining those care packages through reablement, but most importantly about getting people out of hospital in the right way, but with the help of a new way in which we deliver care through remote care, provided and supported by individuals and organisations like Nyree and Cornwall Housing, but also supported by us at Service Robotics with our digital support worker schemes as well, enabling the barriers to capacity and resource that the care provision is facing, and helping support that in the way in which we can resource and help support those individuals as well.
Imogen, I'll just add to that if I may, because we've had a question come in about reminders, and just to bring that to life a little bit for reablement, if you can imagine a scenario where you have somebody who's been newly discharged from hospital with a condition that requires a dressing change or pain management or those kind of things, using reminders on Genie to check in on them, asking the question, is your pain better or worse? Does your dressing need changing? They're simple yes or no answers, and that gives the feedback to the team to know what is needed and to be able to schedule that care in when the actual physical visit takes place. So it's a information gathering, but also monitoring type service that enables this discharge to be successful, in that the people can continue to survive and thrive on their own, and, as Imogen said, crucially, don't become dependent on the delivery of care.
And one thing that we haven't mentioned, but is pivotal within this side, is around data and outcomes as well. And it's something that we've used throughout the whole thread of our interaction and partnership with Cornwall Housing, and how that service is developed through collecting that data and interpreting it into a way in which we're then looking at people's care packages, and the way that care is delivered, to then better optimise that for that individual, and understanding then where there needs to be further engagement or training with technology, or whether it is suitable, whether there's more reminders, what reminders and prompts could be set up or change as that person's care needs also change. The data and the dashboard that we present and that we customise for each individual is super important in order to reach those outcomes of deploying technology and making sure that is the right package for that individual, and having our support fully within that process as well. So just to summarise, obviously, when you hear around these webinars and all the information, sometimes you think, what's next? How do I get our services involved with remote care? And what we've talked about today is really around remote care, enabling new models of care. And what we've done is we've put together sort of 5 steps in order to look at how we address these new models of care within different service provisions. The first thing really is, we only went through a short demonstration of Genie, and obviously we've heard from Nyree and all the great stories and experiences of outcomes that we've now got from Cornwall Housing and the individuals we've been supporting. But every service is different. So what we recommend is to have a private sort of consultation and demonstration with our service, so that we can look at the problems that need a new approach. So looking at reablement, whether it's staff shortages, whether it's building up trust within the team, whether it's around increasing accessibility, and looking at all of those things and understanding, well, how can remote care through GenieConnect help with your service provision, and how many things and how many tasks can we make automated. So this is around the evaluation part of the service. So we talked around using prompts and reminders to better optimise how in-person care is delivered, to make sure that the time spent with those individuals are on the more meaningful tasks, whilst looking at then the other tasks around medication, around hydration prompting, around doing the washing up and household and personal hygiene tasks. How many of those are we currently overprescribing with in-person care, when actually a prompt that helps with that individual's independence can be utilised through the method of Genie and a remote care service, and how that frees up then the care capacity as well. Thirdly, we go through review. So we'll review your workforce readiness. So as Nyree said, it's around getting the team on board and having that buy-in from the very beginning. It's a change of how care is delivered, and therefore that excitement and what the benefits are to both the workforce and the individuals that are going to be receiving remote care through Genie. It's really important to get that set up and have that full support at the start. And we help with that through lots of demonstrations and training and sharing these case studies, these great case studies that Nyree shared with us. On the 4th step, it's around implementation. So we provide a full implementation service. So in terms of worrying around barriers to resourcing, the implementation, the training, we take that away with the help of our digital support workers. So we're there to help you at every step of the way to make sure that it's implemented with the right individuals and the right services through that pre-planning phase of the reviewing and evaluating stages, and then supporting that ongoing, not just through that initial implementation, which also spreads into the data analytics and reviewing those care packages at certain timeframes going forward. Which leads me on to impact, which is the main thing of implementing all of this. We want to have the impact where we collect the data and the outcomes with our dashboard to further enhance the care quality and review the care packages and review the impact that it's having on your workforce, with the ultimate aim of increasing capacity, trying to decrease some of the barriers that are currently being faced with the delivery of care, but ultimately providing the right care for that individual in the right manner. So with all of this, we are there with you at every step of the way as Service Robotics, and partnering with individuals like Nyree. We're also able to collect up this network of individuals for you to connect with and share stories and share experiences as well. So with all that in mind, we're drawing to a close with 5 minutes to go, which is brilliant. So if there are any questions, we'd like to invite to the table. I know we've had a couple in the chat already, but if anyone wants to unmute yourself. Yeah, go for it.
Yeah, there's one I'll take if you like, Imogen. There's one from David on privacy. So worth just mentioning that the GenieConnect platform is a closed platform. So it's curated by Service Robotics and our clients. So nobody can access the platform unless they are authorized to do so, and unless they're invited to use, for example, the companion app. So in terms of privacy, the platform has been designed from the get-go with GDPR in mind, and we do regular data impact assessments to make sure that this is a completely secure system. So any further questions on that, we'd be happy to have a more detailed chat, because I do know that is an issue in the industry and a concern with new assistive technologies like this. Okay, we have another question here from Sally. I'm exploring new technologies in my care company. My concern is identifying the right users. How do you best advise approaching this? Imogen, do you want to take that one?
Yeah, I can take that one, and Nyree, if you want to chip in as well, if there's anything as well. So within the individuals that we work very much with the partners and the care providers and the councils in order to help identify those right individuals, and that comes from a starting point which is around a certain criteria of those individuals and their abilities. Secondly to that, we then draw up an outcome profile. So we look at all of the needs in which that person is currently needing, or where the gaps are within their care, and aligning that to see if Genie is the right solution to address those. And then with that sort of matchmaking process, we end up then with a very tailored platform and the way in which Genie is configured to help identify with those certain needs. But it's very much built upon a partnership with both of Service Robotics and the care providers or the councils, working from the off about what are the aims, where are the services in which Genie is going to be provided in, and then matching those outcomes with the features that Genie can deliver.
We've also put together simple sort of assessment tools that officers can go out and use when they're meeting with their clients, and it's sort of simple sort of tick boxes to identify whether or not Genie would be suitable. And one of the other things that I would say is expect the unexpected, because I think so some of my officers at the very beginning of our journey were a bit, I don't think older people are going to be into this, I don't think they're going to be able to manage it, and it's about changing those perceptions. So I don't think it's sometimes for us to decide who we think would or wouldn't be a good user, because we've had people that we would have said no, they're not going to engage with it, and they really, really have. And I think Genie can be open to nearly, not everybody, there are some exceptions, but to most people, if it's delivered in the right way and they're given the confidence in which to do that. And to do that, you need this support. You always have the support from Service Robotics, but also as well from the team that are delivering those services. So yeah, never rule anybody out.
Yeah, and actually just to very quickly dive into that a little bit more, because of the question from John around how those that perhaps aren't so au fait with IT can use Genie. There's two answers to the question. The first of all, as Nyree has been saying, it actually isn't for everybody. But the second answer is it's for more people than you think it is, because there's a reason that, for example, smart speaker penetration is so poor in the older adults communities, because there is no support. And most people just need that little bit of support to give them the confidence in using a system and to break through that barrier, as we've said in one of the examples that Nyree gave. So it's too easy to say not all older adults are interested in using technology, because when they see the benefits and when they're supported every step of the way through, they can and they do use it and get the benefits. So yes. I think we need to close now. Am I right, Tammy? We've reached the end of the session. So I just want to say, you know, this is a new industry. This is a new way forward for care. And I'm talking about assistive technologies generally. And in any new scenario like this, you need the people who believe in the system, the pioneers, the people who are brave enough to try it. And we've got exactly that in Nyree at Cornwall Housing. So many, many thanks for not just your contribution today, but your commitment to seeing this through and to spreading the word to others who can also help to, you know, improve lives for many people. I think, Imogen, do you want to just make some final comments on next steps, perhaps?
Yeah, so just highlighting what I went through in the last slide before the questions. It's really important if you want to understand more around how it could be beneficial to your service and to get going. Send me an email. I think my email is somewhere, or Tammy, who's been sending the emails out, to get something in the diary where we can then discuss around what next steps will look like, as well as sharing you the available funding paths that our different partners have also been uncovering. As I know, it's again, there's some pots of money that are out there, and you hear about these things, but how to access them is another challenge. And so we're able to help with that side of it as well. So yeah, just a big thank you, and a big thank you to Nyree as well for joining us and sharing all of the stories and experiences that she's had with Genie, and many more to come.